Next we're going to test the length of the hamstrings. And we've got the two semis on the inside, the semitendinosous and semimembranosus. On the outside we have the biceps femoris. One of the easiest ways is, rather than myself lifting the leg and feeling for bind, keep the opposite leg straight and ask the patient to slowly lift the right leg, as far as they comfortably can. If she can get the leg to 90 degrees, we don't really need to go much further. Okay, otherwise you'll be classified as hypermobile. You can also, from this position, look at the position of the foot to see if there is a perception of tightness within the gastrocnemius. So if the patient is able to get the leg to 90 degrees and 90 degrees of dorsiflexion, then the gastrocs and the hamstring group are pretty tight. If the foot is resistive in this position, then that obviously tests the gastrocnemius. We can bend the knee, and then we can see if there is more range of motion. If the answer is yes, then it means the gastroc is tight. If it's still stiff, then either the soleus is tight or there is a restriction of the talocrural joint here. Now, in terms of the hamstring, imagine that when I lift the leg, it's around 45 degrees. I don't know if the inner hamstrings or the outer hamstrings are the tight structure. So what I would do, to test the biceps femoris, I would feel the bind. I would slowly internally rotate and adduct to see where the resistance is felt. And for the semis, I would externally rotate and I would abduct to see where the resistance is felt. If the resistance is felt going into external rotation to abduction, it is the semis that are restrictive. If there is resistance on internal rotation and adduction, then it means the biceps femoris is the restrictive tissue. As I said earlier, if you can get the leg to 90 degrees, there's no need to turn the leg internally or externally. If you want to lengthen the hamstrings as a group, then you can place the leg onto your shoulder. I'll do this one for the demo. You can stabilize the opposite leg. From this position, take a small breath. Push your leg down towards me, please. So the patient is pushing 20% effort using all the hamstring muscle group. After the 10 seconds, breathe in. And then on the out breath, I have a choice. I can slowly lift the leg this way, or I can use my own posture and just go with the patient until we approximate 90 degrees. So the patient breathes in and pushes their leg again. So they are activating as a whole. And in this case, we are using the semis and the biceps femoris. But if you think about where the movement is coming from, on the out breath, we are moving from the hip. Can you see that? So the hip is moving, not the knee. So we're actually lengthening more at the origin. If we want to activate more of the insertion, we can do the same technique, but we bend the knee. So this time we ask the patient to pull the heel down towards the bum. So this works the insertion of both sides. 10 seconds later, breathe in. And then what I do, I would slowly try to straighten the leg. Watch again. I'll show you variation. Pull down. So we're activating the insertion fibers. After 10 seconds, I normally would add this technique in, and I like it a lot. I would say to my patient, slowly activate the quadricep, and by doing so, tells the hamstrings to relax, and that would be like an RI, a reciprocal inhibition technique. And it works very well in MET. If we want to lengthen more of the semis, we turn the leg out, and then we ask a patient to push the leg in. So she is pushing, using more of the inner hamstring. And after 10 seconds, breathe in. And I stabilize the opposite leg, and I can control the leg going away. And we can lengthen the semis, and you can see that she's pretty flexible in that plane of motion. If you find it hard on the arm and the weight, we can come in this way, and you might find that slightly easier. To lengthen the biceps femoris, we would turn the leg in, take the leg into this position, and then get the patient to push towards me for 10 seconds. And after 10 seconds, relax, breathe. And as I breathe out, I would bring the leg across, lengthening more the biceps femoris. Again, if a leg is heavy and you feel it is compromising your own back, then what you can do is do the same technique, but on the opposite side. So you can bring the leg up, turn the leg in, bring the leg over, and now it's easier to control it towards you rather than leaning away. So if your patient pushes your leg this way for 10 seconds, after the 10 seconds, breathe in, and on the out breath, I would bring the leg across that way. And you might find that would be slightly easier compared to the first one, but only with a heavy leg.